Okay, great. Thank you. And good morning. Good morning, everyone. On behalf of the Board of Directors and staff, I'd like to welcome Governor Newsom, Secretary Galley, Judge Manley, Senator Cortese, Supervisor Chavez, Mayor Gloria, Mayor Schaaf, and other VIPs to Momentum for Health. Momentum is honored to host this important announcement by Governor Newsom. We are at Crossroads Village, residential village, Momentum's flagship residential treatment program. Since the 1980s, adults have come here to find their path to recovery in a supportive community environment. People come to Crossroads when they need time to find their way to independence. Clients typically stay for anywhere between 3 to 12 months while they live in private dorms, share meals, and attend groups and therapeutic activities together. Case managers work closely with every client to design a custom treatment plan according to their individual goals, and they and the rest of the care team of counselors, nurses, clinicians, doctors work together to help each client build skills to achieve their personal recovery goals. Some of the activities clients enjoyed include art therapy, gardening, yoga, and other creative programming. I am very proud to be the CEO of Momentum for Health. My name is David Mineta. Next door to us is a 16-bed crisis residential program where community members who are experiencing a mental health crisis can come for a shorter stay of 19 to 90 days, stabilize, and then return to a lower level of care. And in front is an adult outpatient team serving the diverse greater East San Jose community. This is a community behavioral health treatment campus. Momentum is a community-based nonprofit organization in a network of other amazing community-based organizations, providing vital mental health and substance use disorder services to Santa Clara County residents. Our services are provided through contract and partnership with Santa Clara County Behavioral Health Services Department, and we are very, very fortunate to have a supportive board of supervisors and county administration supporting behavioral health services. They recognize the behavioral health crisis we are in and made that declaration a month ago. We are equally grateful for strong relations with our local courts, especially the behavioral health courts. We all do so in the midst of a worldwide pandemic where behavioral health disorders are increasing by number and acuity across all demographic groups, with an alarming and unfortunate disproportionate volume of anguish rendered on communities of color and folks from the LGBTQ community. As behavioral health disorders across our community rise in number and acuity, we are experiencing one of the worst and most severe worker shortages I have ever seen in my 30-plus year career. As with other allied healthcare staff, our behavioral health workforce has worked tirelessly through the entire course of the pandemic to keep our doors open, to keep our life-saving services going. Through every COVID wave, we've stayed open thanks to a very dedicated workforce. With Governor Newsom by my side, today is also Worker Appreciation Day here at Momentum. And I want to thank our case managers, our clinicians, our nurses, our MDs, our managers, our IT staff, our admins, benefits staff, and all our workers for their heroism and grit to keep services open. Finally, I would say how grateful we are for the governor's support of behavioral health services to our community's most vulnerable. Previously, I worked for a White House that focused on these very issues. Creative and committed executive leadership, as we are witnessing today by the presence of Governor Newsom, in partnership with the courts, counties, cities, and neighborhoods block by block, is the only way we can close long-standing pernicious behavioral health disparities. Thank you, Governor Newsom, for coming to San Jose and to Momentum. I am honored to introduce the next speaker, my colleague, Rovina Nimbalkar, CEO of NAMI Santa Clara.
Thank you so much, Dave. Good morning, everyone. I'm Rovina Nimbalkar, and I'm the Executive Director at NAMI Santa Clara County. I speak on behalf of individuals and families with a mental health diagnosis. NAMI supports these individuals and families through education, advocacy, support, and resources. Individuals living with a serious mental illness continue to harm regardless of multiple outreach attempts by our outpatient system. Without some level of intervention, they will end up in jail, in prison, homeless, or dead. The many families who contact NAMI Santa Clara County in desperation trying to find help for their very ill family members further substantiate this. We really appreciate Governor Newsom's initiative on the Court Care program, a program that uses civil court accountability with community-based solution with an emphasis on housing is much needed in California. The Board of Directors of NAMI Santa Clara County and I support the Court Care program. And with the Court Care program in place, we will have an opportunity to help these individuals start along the road to recovery and to a more fulfilling life. Thank you so much. And now I invite Tamika Moss.
Good morning. My name is Tamika Moss, and I'm the CEO of All Home California. We work on homelessness and housing security issues across the Bay Area, and I'm so honored to be here today because this is the most critical issue of our time. We are facing a crisis of epic proportion in terms of those who are experiencing homelessness in our state, those who are suffering from behavioral health challenges and not having access to the support that they need. This kind of innovative solution that Governor Newsom is introducing today is exactly the kind of comprehensive support services and approaches that we need to be amplifying across our state. And I am so honored as a provider, as an advocate, someone who's been working in vulnerable communities for more than 25 years in the Bay Area, and having an opportunity to work with Governor Newsom when he was the mayor of San Francisco on a very similar initiative to really intervene before someone has to interact with the criminal justice system. People deserve dignity, they deserve support, and they deserve care. And this is what this initiative is providing. We must also recognize that the fastest solution to homelessness is housing. And being able to combine behavioral health support with housing is a critical component of success in our communities. And I am so honored to be a part of this conversation today, but also working with everyone in our ecosystem, our courts, our community health providers, our mayors, our legislators. Everyone has a role to play in the success of bringing all of our neighbors indoors. And I'm honored to be here today and supporting this important initiative. And it is my pleasure to introduce Mayor Gloria. Thank you.
Thank you, Tamika, and good morning, everyone. I'm San Diego Mayor Todd Gloria, and I'm pleased to be here today in support of Governor Newsom's proposal, which is an issue of paramount importance to the people of San Diego, and I think for folks all throughout California. In my State of the City address this past January, I announced that I would dedicate my efforts as mayor of the state's second largest city to reforming California's conservatorship laws. As a part of that address, I made the point that it's time that we face the painful and obvious truth. Our behavioral health system in California is broken, and now is the time to fix it. For far too long, government at every level has allowed individuals who struggle with mental illness and addiction to languish untreated on our streets, cycling between our jails and emergency rooms with little hope of ever getting the care that they truly and desperately need. Over the last several years, cities like mine have seen a tremendous amount of investment from the state of California to create more housing, more shelter beds, more services to address homelessness. But the public doesn't see progress on these streets. In fact, some would say that it looks worse than it has ever looked. And I agree. The truth of the matter is that if we want to get serious about meaningfully addressing our homelessness crisis, we have to have effective tools to deal with the behavioral health issues that we see all around us in every corner of our state. Governor Newsom's Care Court proposal is a major step forward. It will provide individuals who are struggling with behavioral health issues a pathway to housing and health services that they need. And it will provide those who encounter these individuals a real way to get them the help that they need. While Care Court is not conservatorship, it could eventually lead to conservatorship. And the aim of Care Court is to reach people at an earlier stage, before they deteriorate over repeated crises, which is the only way so many of our folks can gain access to the housing and services they truly need right now. We can't afford to wait that long for interventions that can turn around and save lives. And we cannot continue to invest billions of public dollars in a process that requires someone to go through that kind of crisis before we're willing to acknowledge that they need help. Last year, in the city of San Diego, our city's paramedics, firefighters, and police officers spent nearly 400 service hours every day responding to behavioral health emergency calls from people in crisis. Care Court will give my city the tools to ensure that people struggling with these behavioral health issues are prioritized to receive the services and housing that will keep them out of the emergency room system, off the streets, and on a path to a much better life. I'm committed today to working with our governor, with state legislators, my fellow mayors, such as the Big City Mayors Association, which you'll hear from in a moment, as well as local partners at all levels of government, to build a diverse and strong coalition to support Care Court and to implement it quickly, because that's what Californians want us to do. I want to thank the governor for his leadership on this matter and for taking this bold step today to build a better behavioral health system for all of us. Thank you. And with that, I would travel more than 500 miles to introduce the mayor of Oakland, the chair of the Big City Mayors Group in California, and a member of the Governor's Homelessness Council, my friend, Mayor Libby Schaaf.
It's time that our golden state stops walking by our greatest moral shame and faces it head on with clarity and compassion. I am here today to support the Care Court proposal as the bold change that California needs right now. What I appreciate, what excites me about Care Courts, is that it stands for the value that care for our most vulnerable should not be optional. It should be a legal mandate. And this idea of a legal mandate is one that came out of the governor's Regional Council of Homeless Advisors. I was out last week on Oakland's homeless count with hundreds of other volunteers in the dark and freezing cold. Our feet were wet from the dew on the grass. And I lost all my composure when I had to chase a rat off of a sleeping woman. But I came to find out from someone familiar with her that she had been living in that same spot for 3 years, feeding rats on a regular basis because they were her chosen company. She had been offered care, shelter, housing countless times, but had been left to freeze on the pavement in our city. If we are to call ourselves a civilized society and a golden state, we must take bold action now. I believe Care Courts is that bold action. I am excited to introduce to you our next speaker, someone who I have loved working with for many years. We are in his hometown where he grew up and where he proudly represents it as State Senator Dave Cortese.
Well, thank you, Mayor Schaaf. Thank you, Governor, for what you're doing today with this announcement. I like the name of the facility here, Crossroads. McKee and White, truly all my life has been a crossroads for me. And I think this program is going to be a crossroads for all of us in terms of how we deal with mental health, with behavioral health issues. I want to thank David Mineta for running what I think is the best mental health and behavioral health organization in Santa Clara County, and thank you for having us today. Thank you. I've been saying for a while, and I said it as recently as yesterday in a Senate Budget Subcommittee, that we have to move mental health issues from a criminal platform to a healthcare platform, and we need to make that shift. And that's really the crossroads that we're at, and that's why the governor's announcement today about Care Court is so important. What we just heard from Mayor Schaaf about the homeless individual she was describing is an indecency. And it's indecent for us, even in this wealthiest county in the world, to have 38% of our homeless population clinically diagnosed with mental health issues and living outside unsheltered as we speak. It's indecent for us to have a jail system here in Santa Clara County where nearly half of the jail population, which the next speaker just told me today is about 2,600, about half of them are clinically diagnosed with mental health issues, but they're not referred to mental health facilities. And it's indecent for families in this community where I grew up to not have the ability to refer loved ones to the proper care like they will be with Care Court. And we need to get this done, and we need to get the legislative cooperation. And Governor Newsom, I stand with you, as so many of my colleagues will, on this matter. Thank you so much. And thank you all for what you're doing. And let me now introduce somebody on the front lines who understands what's really going on and the need for this program as much as anybody I know, our great judge here in Santa Clara County, Judge Manley.
Thank you, Senator Cortese, and good afternoon. As a Superior Court judge, I preside over a very large program for the mentally ill, particularly for those who are most challenged and who spend far too much time in our jail, if not in prison. We need to stop trying to fix a failed system that is rapidly, in my view, from what I see every day, moving us back to where we were 100 years ago, where the answer for the mentally ill was simply to incarcerate them, put them in a hospital, and keep them there forever until they died. We need to stop trying to fix what is broken and embrace the new approach that Governor Newsom is advancing. Mental health is a real crisis in the court system. It's a crisis in our community. It's a crisis across the state. I am pleased to say that in our county, our Board of Supervisors has declared mental illness and substance abuse as a crisis and has made the same commitment that our governor has made to do something about it now. I do want to note something that I see every day in my work that I think is very positive and very supportive of what the governor has proposed. I have been able to order the release of a substantial number of individuals who otherwise would be committed to the state hospital and locked up and kept there often for as long as 2 years. And I've been able to release them into the community, into treatment programs like the wonderful one that we are at today with David Mineta and his incredible staff. And the amazing thing to me is, despite all the criticism, these individuals are succeeding. We have a substantial number of graduates. We have diverted people who otherwise must be sent to the state hospital under state law, and we've done it successfully. Most importantly to me is not only that they've restored their lives, but they're not committing new crimes. And that's what we have to remember, that this program is offering us something that judges really, in my personal view, have not had before. We need alternatives. We are tied down by statutes that direct us as to what we must do in certain cases. Those statutes really have not been changed in years and years and years. We need a fresh approach, and that's what the governor is offering us. The expansion of community treatment, funding for housing for the mentally ill, is going to make an incredible difference, in my view. If we stop looking at this as a problem that the courts must resolve through litigation, arguments, and act as a neutral observer and a fair decision maker, we aren't going to get anywhere. Because the courts, judges do not have the alternatives that they need to be able to treat people with the compassion and dignity that they deserve. Mental illness is not a crime, and we need to do something to help those people who get caught up in our system again and again and again. I would close with this. This proposal of our governor offers real hope. Hope for change that has been needed for so many, many years. I also want to acknowledge, standing right next to me, our interpreter. And I can tell you, she is of such value. She helps me all the time in court, and I will tell you it is a real challenge, and without her help, we wouldn't be able to give the assistance to those who are deaf, and also for those who don't even know how to sign. And so it's a blessing. I'm now, it's an honor to introduce, and I'm not going to get his name right because it was just given to me, but I do know his son, Tony Lazzarato. Did I get that right, Tony? Was I close? Thank you, Tony.
It's Lazzarino. But I have to say, Judge Manley is an incredible blessing to our family. We wouldn't want our son to go anywhere but his court. And NAMI has just been incredible in an organization, also in the 20 years that we've been in the system. And Momentum, Crossroads here, our wife and I thank God every day for this place, the way the care has come to our son, and we're so grateful. And I'm really glad to see what's going on here. It's just an incredible blessing knowing that NAMI's involved, Judge Manley's involved, Momentum's involved to help the governor do things that can just improve the system for mental illness. There's a lot of bad things that we've seen over the 20 years with our son. And to know that there's these organizations that really understand and are right, I couldn't ask for more. So thank you. And I'd like to introduce Dr. Gailey.
Good afternoon. Really pleasure to be here on this important day for this very critical, important announcement. I just want to start by thanking David, you and your team for welcoming us here. This is about work in the community for the community. Today is really about three things. It's about a paradigm shift, it's about partnership, and it's about the people we're here to serve. And when I think about the paradigm shift, you heard others before me talk about how what we have today doesn't work. But that's not because people aren't working hard. There's plenty of people working really hard today. You witnessed that behind me. You witnessed that throughout this county. The leaders at the county, their providers, all across this great state, the city partnerships, there's a lot of them. But as Judge Manley, you said, we have to unlock a set of different tools, and today that paradigm shift starts. That paradigm shift starts with taking this upstream. Why do we have to wait so long for people to be so sick, the sickest of the sick, on the streets, in our jails, in our hospitals, decompensated? We can do better. As you said, Mayor Schaaf, we can and must do better. That care and that compassion must be the California way. That paradigm shift is about looking to the courts, not the criminal courts, but that civil court, to really hold all of us accountable to serve the people that are suffering every single day. That paradigm shift is about recognizing that 1960 era views on mental health and the laws that govern mental health here in California recognize the incredible advances that we've made in the field of psychiatric care, in the field of community-based services, and insist on old and broken models. How do we move forward and do things like we've never done before? And these aren't new ideas. They're ideas that happen every single day in communities like this right behind me, where we use the tools and the medications, the love and compassion and training of lots of people to wrap around individuals who are suffering on the streets, but not all on the streets, some in families struggling, and have that chance to put together those tools that we have to unleash and unlock in a thoughtful, evidence-based way that Care Court really brings together. I'll talk about partnership too, because I think it's so important. Today is about unveiling a framework that starts with a lot of conversations. We've started them already, and we look forward to having many, many more. Partnership with people with lived experience, those who experience the tragedy of the systems that we're trying to change, those individuals who have family members who are living with serious mental illness, as we try to restore that illness to health. And those partnerships are going to matter. Our disability rights communities, our county partners, our city partners, our clinic providers, just like here, our legislative partners, all of the above. Naomi, I'm really happy to see you here. The partnership that we have with family members can be strengthened through the conversations in the weeks and months to come as we take this framework and make it something that works for more Californians. And I'll talk now about the people, and the people are why we're here. Too often we see people, as Mayor Schaaf said, that we pass by. We don't know what to do. We don't know how to serve them. We want to, many of us, but we just don't know how, and we wonder in puzzlement how we can announce initiative after initiative, yet they don't see the changes Mayor Gloria identified that we want to see. And those people, loved ones, family members, people that I've had the privilege of working for and with, this idea that Care Court allows us to have a whole set of new varieties of people who can refer that individual into this Care Court process. And once referred in, whether that comes through a family member, a first responder, a community member, a clinician at a hospital or a clinic, and found through an evaluation at the courts, through the Care Court model, to be eligible for the Care Court program, then we develop a plan. This plan isn't new and fancy. It really just brings together what I like to think is the 1-2 punch of clinical services with a focus on medications, as well as a housing plan. And when you put those things together, I often listen. The clinicians tell me we don't have enough housing. The housing folks tell us we don't have enough clinical care. We're going to hold ourselves accountable to deliver all of that together in a comprehensive package. That individual will have court representation as well, and a new idea, really stolen, taken, borrowed from the disability rights community around a supporter. What is broken in part about our conservatorship laws is that it substitutes the decision-making process. We're here about supportive decision-making, coming in, working with stabilizing individuals, to the point where that insight, that judgment that's missing to make important clinical medical decisions begins to get restored, and that supporter, this new position, this new person available to help bring the best out of the client's wishes, making sure that that's part of this long, big plan, and that over time, that individual also can put together a mental health advance directive that helps us know what to do if and when the client destabilizes, medication changes to their disease, not unexpected. We should be ready by making sure we capture the wishes of that person in what we do. And then, of course, there's the accountability piece, not just on the individual, but on us as providers, as us as partners through government and clinical services to make sure that we're prioritizing this population. No longer should we walk down the street and not know what to do. We need to respond in unison that we can do something different for this population. And Judge Manley, you're right. Too many end up in our justice system, and we know that to be one of the tragedies of our day. I have the privilege of working with this amazing crew of people at the Department of State Hospitals who waits there, unfortunately, and welcomes some of the sickest people in our state into their programs, and they wish, like I do, that we don't have to wait so long. How do we go upstream? It's not upstream in the way of earlier disease. These are people who are very sick, but we don't need them to get arrested to provide this level of care, and that's what Care Court is seeking to do. And we know today that half of the felony IST, incompetent to stand trial population that comes to the state hospitals, the 6 months before, they don't have any clinical interactions. Their last interaction was with the criminal justice system. We can do better, and that's what today is about. So as I reflect on what we're here to talk about, I want to make sure to close revisiting this partnership idea. Today, we start an invitation to many to come and join us to talk about how we do this the best we can, that California way, leading with care and compassion. I have the privilege every day to work with thousands of people in state government, working with people in counties and cities and families, and I have no doubt, Governor, that your vision for a new way of doing business around mental illness, not just mental health, but the real illness on our streets, that today is about that invitation. And with that, I will invite our great governor of California to really share the vision of what we're here to talk about today. Thank you.
Thank you, Doctor. Well, thank you, everybody. Thank you for your patience. I'll try to be as succinct as possible. It may not feel like, Worker Appreciation Day, making you all stand up in the corner over there. I don't know if any of you can see them, but we're grateful to all of you, and we wouldn't be here without you. So I want to extend my appreciation to all of you, the extraordinary frontline employees that make all of Dave's success work every day. Let me also just express gratitude. I think it's not an insignificant moment when we're here in San Jose, but with the mayor of San Diego and the mayor representing the big 13 mayors in the state of California from Oakland. This gives you a sense of the magnitude of this moment, the magnitude of this issue, the magnitude of what has appropriately been described as the crisis that we are trying to address here today. I'm grateful to the senator for his leadership and his comments. I couldn't agree more. We need to treat brain health early before we punish it later, and that's foundational in our efforts and our partnership with the legislature, which I'll brag on more in a moment. But I want to contextualize this a little bit because Judge Manley hit on something that that hit a chord with me. We've been asking the wrong question. There's an old adage, if you don't like the answer, ask a better question. And for years and years and years, we've been asking the wrong questions. And it goes to the core of what the judge was offering. And that was his perspective on the front lines that we were trying to reform a broken system. And in the margin, we were reforming it. We made progress with Laura's Law, opt out, opt in. But when you looked at the results, 200, by the way, this is an exact number, 218 people in the entire state of California served by Laura's Law. That wasn't much of a reform. That certainly is not demonstrable progress. When you look at LPS, Lanterman-Petrosort Act, going back to my birth, mid-1960s, we're talking about a world that no longer exists. We're debating old debates, wounds on all sides of the aisle. People that want to reform in this direction, people feel it's over, we reform too much in the other direction. And so we decided to take a different tact, a different approach. And we started having conversations anew, started asking better questions, and that's where we landed on this new approach. Rather than reforming in the margins a system that is foundationally and fundamentally broken, we're taking a new approach. And we're offering a new strategy and new partnerships, but we're offering it in a way that we haven't in the past. And that's with resources. We have not taken our eye off the ball on the issue of homelessness and mental health in this state in the last 3 years. I know everybody thinks we've been zigging and zagging from crisis to crisis, and oftentimes that means we've lost sight of what's in front of us, the issue and the crisis of what's happening on the streets and sidewalks across the state. We haven't. When we got here 3 years ago, the state of California had no plan, no homeless plan, nothing. Didn't exist. There was no strategy, there was no plan. There was no accountability. There was a $500 million appropriation that went to the cities and counties, but that was it. That was 3 years ago. I want folks to know what exists today and what we're promoting into the future. We have approved $12 billion from $500 million and no plan, no accountability, to a $12 billion multi-year investment that has been approved by the legislature, where we are investing in proven evidence-based strategies with accountability plans required for the first time in history and oversight, with a resourceful mindset to build and rebuild and reimagine a future by developing partnerships that we could not develop in the past because we didn't have the resources to back them up. We have developed and organized and architected a system that has been backed up by unprecedented investments, including an additional $2 billion that's in front of the legislature for consideration. If they approve that package, $14 billion will back up this approach in this new strategy. And by the way, that includes $3 billion specifically to build housing and support clinical placements for people with severe mental illness. By the way, that's the biggest expansion in this space since we started dismantling the system infamously in that first Governor Reagan budget in 1967. We couldn't get to this point without having done that work in the last few years. Because every time you enter into this conversation, people are understandably concerned about all the support that is expected but doesn't exist, and then the demands we make on the cities and counties and care providers where they have no placements, they have no capacity to actually perform. We flipped that paradigm. We are now providing unprecedented supports. And by the way, just on the Prop 63 Mental Health Service Act, just a few years ago it was $2.1 billion. Ongoing money this year, $3.7 billion. 2.1 to 3.7 billion. We're not only putting the money, as I noted, in that $14 billion broad package, but we put, and you heard Dr. Galley reference IST, we put $650 million of additional money just in the IST program this year. That's in front of the legislature for consideration to start to address the gaps in that space. We put $4 billion approved, thank you, Senator, thank you, now Mayor, then former legislator, Gloria, advancing $4 billion to provide comprehensive services screening and support for all of our kids 0 to 26 in this state. That's the most significant mental health investment that we've ever made in the state's history. That's in addition to everything else we're talking about. That's just broadly to deal with all of the challenges and stress that our kids are suffering through, not least of which over the course of the last couple of years through this crisis. So I want to just emphasize this point, and I don't want to get too lost in the weeds. We've put out these details into the public, but I want folks to know we are taking a new strategy, taking accountability across the spectrum. And it's not just, as the doctor said, Gally, it's not just for individuals, it's also for the system. We got to deliver. You deserve it. What's happening in this state, as Mayor Schaaf said, is unacceptable. There's no compassion stepping over people in the streets and sidewalks. There's no compassion in reading about someone losing their life under 280 in an encampment. There's no compassion in that. I mean, we could hold hands, have a candlelight vigil, talk about the way the world should be, or we could take some damn responsibility to implement our ideals. And that's what we're doing differently here. And that's what we're advancing differently here today. In this care court, it's going to be stubborn. We got work to do. We got to get approved by the legislature. We want to move this in the next couple of months. But we have partners, not just Judge Manley, the courts themselves. The Judicial Council has been incredible, helping support and guide and advise. This framework in the disability community of not being substituted in the treatment, but being supportive is profoundly important. And that's why we have a lot of leaders in the disability rights community that says, all right, I'm open to what you're doing in a way in the past where I may not have been. And that's exciting. Care plans, support, community-based organizations supporting those care plans, counties supporting those efforts, real accountability. And as Todd said, in the back end, if that accountability doesn't go into effect, we have the ability to now move people on the back end with a presumption through the more traditional mechanisms to get people the help that they deserve. Those that, again, are on the psychiatric, are dealing with psychotic disorder or schizophrenia spectrum, folks that just simply can't help themselves. We know, and I'll close on this, we know the magnitude of this. And I want you to know what those dollars represent, because we can sometimes get confused, billions of dollars, and what does it mean? If the budget's approved this year, we will have support specifically for 33,000 new beds and placements, clinically supported new beds and placements, 33,000 in this state. That's not insignificant. That's without, again, any precedent in California's history. So, again, we're putting everything we can into this. We recognize what you see every single day. It's unacceptable. And we recognize our responsibility, our moral responsibility. And Tony, thank you. I got 4 kids. I can't imagine how hard this is. And, we just met with some parents. I mean, for the grace of God, go every single one of us. And it breaks your heart. I mean, your life just torn asunder because you're desperately trying to reach someone you love, and you watch them suffer, and you watch a system that consistently lets you down and lets them down. And so, yeah, this is about accountability, but it is, as we said, about compassion, and it's about recognizing the human condition. And that's why I appreciated what Dr. Galley said. This is the California way. We're coming up with a completely new paradigm. It's a new approach, different pathway, and it's consistent with our values, but it also, I think, is consistent with the urgency of this moment, which is the accountability that will drive this plan and we believe produce real results. So that's broad strokes where we are. We got hard work to do in the next few weeks, working with the legislature. We'd like to get this done with the budget, and that's where I think it belongs. We would put real resources in so that we're not debating things in isolation. We want both to go hand in hand. And that means moving this quite literally over the course of the next number of weeks, working with legislative leaders, and then driving these reforms in a way where we can hit the ground running by the end of this calendar year and really start seeing results all across our great state. So with that, again, I'm grateful to all the remarkable leaders that are here and been so supportive of this effort. And I'm grateful again to a workforce that needs to be supported as well and nourished and developed, that is also foundational in terms of our efforts to make real what we're promoting here today. So with that, we're here, of course, to answer any questions that you may have.
Hi, so I'm Stephanie Magallon with NBC Bay Area and Telemundo 48. One of my questions is, we've heard from health clinicians that we already don't have enough treatment beds and staff. So is the funding also going to help these sort of treatment facilities? Specifically.
I mean, and I think it's an opportunity. It's important that I repeat what I just said. Unprecedented investments, billions and billions of dollars, multi-year investments to develop the infrastructure, not just the physical infrastructure, but the workforce, the human infrastructure that's necessary to go hand in hand in developing this strategy. We're not status quo ante. We're not arguing for what exists today. We are arguing to invest in an unprecedented growth of the available slots and spots and clinically supported services. And that's what makes this proposal very different than previous proposals in the past.
Governor Newsom, Kathy Novak from KCBS Radio. We've all seen people obviously in distress in the streets needing help. Mayor Schaaf gave the example of the woman she encountered during the homeless count in Oakland. Can you give sort of a concrete example of a situation of what might change in that kind of scenario? Yeah. Who would step in and what would happen next for that kind of person?
Yeah, so if someone's severely mentally ill, chronic drug addictions that cannot make informed decisions, medical decisions for themselves, they can have a peer provide a pathway to access a care plan by providing information about this individual, providing the opportunity for a plan to be developed with the court's oversight, a plan that would have a advisory body that would review that process in a way where that individual has an advocate, a public defender, and has a peer supporter. That plan would be developed that extends from anywhere from 12 to 24 months. It would be developed with that individual in mind and provide that individual some self-determination in that process. There would be accountability components. If the individual is unwilling or unable to commit to following through on that plan, there will be the capacity to move into a different category of care and support, more traditional along the lines of what we have today through our LPS and conservatorship system. But our hope and expectation is by creating this third pathway that family members, people like Tony, mental health crisis teams, many here assembled today that are mobile and going out, homeless outreach workers, and counties themselves now will have the capacity to save someone's life. The mayor of Oakland could say, this individual, I now have the ability to help this individual who clearly can't help herself and get her off the street so she doesn't become a statistic and give her a chance. And that's what's different about this in a way that is not traditionally coercive and substituting any consideration or rather care that can be self-directed by the client themselves. Forgive me for the long-windedness, but this is nuanced and complex. But we're opening up a spectrum of ability for individuals to actually direct that care in ways we haven't seen in the past. And perhaps the most significant is family members, those first responders that are out there every single day that recognize these symptoms and recognize the challenge. And now they'll have the capacity to direct individuals and get them the support they need.
Hi, Governor Newsom, Tara Campbell with ABC 7. This plan proposal is designed to help get people off the streets. One of the primary difficulties we hear about from those on the streets trying to help those get off the streets is the inability to actually remove them from the streets. How does this proposal change that? Is there a force component to this plan?
Yeah, that's why it's court ordered, court oversight, with specific stepped up sanctions if we can't meet the plan. So that's what's different about this. You have a public defender, the court initiates a care plan and a process. The courts initiate a care plan and a process. There are components to guarantee due process, the civil liberties of those individuals, but the plan allows for a new tool that is not just voluntary, not just stepping aside. It requires a partnership, however, with that individual, and that's where we're trying to find a meeting of minds in terms of a new pathway. Let me be specific. Individual, right now we have about 56,000 people that end up in 5150 a year. That's the 72-hour hold many people know very, very well. You've got 5250, which is a 14-day hold, but the traditional 5150, about 56,000 people last year. Now, we know a lot of people on that 72-hour, even that 14-day hold, they're on their meds. All of a sudden, they're starting to do a little bit better, but there's no place to put them. There's no pathway after that, and they end up right back on the street. Now, with the care plan, this approach with the courts allows in that process to immediately then engage with a court-ordered process, a pathway to actually develop a strategy and a plan with oversight and accountability that will allow that individual with the housing supports that are a component of this to achieve some more permanency and success as opposed to episodic experiences through the 5150 and 5250. So that's an example of what makes this different, an example of a gap that exists and persists in this state.
Just a quick follow-up. So if these people aren't in the system already, will that require that law enforcement goes out to these
This
people?
is family members, first responders, community-led teams, counties, the health system. This is not about, I know everybody has this notion, we're going to round everybody. I mean, this is the dumbest stuff I've ever heard. This is just stuff, golden oldie. Everybody, we're just in, that's what created, forgive me. But it's true, right? The largest mental health institution in the United States is the LA County Jail, all right? Come on, we're as dumb as we want to be, spending exponentially more with no real results. And so this is a completely different approach. So please, I want to get out. This is not just cops going out there arresting folks and then throwing away the key and saying, you have no rights, and we're substituting every damn decision making. This is a completely new strategy. And so I hope, and I hope that it creates a space for a different conversation than we've had in the past. Because it's that old paradigm, as Judge Manley was saying, we're trying to fix a broken system where people just go in their camps immediately and no progress is actually produced. And as I noted, LPS, I think we're about 70, if you add up temporary and permanent last year, about 7,300 people are served. Not overwhelming, 218 just in the Laura's Law. We have scale of a problem, and it's going to require a different scale of approach and a new mindset in terms of how we approach it. And again, that's what Care Court is offering. Well, we have one more. All right. I'm not used to just two questions. There are a few elected officials very happy about this. Anyone else? So that is it. All right. Well, again, and Dr. Galli, you want to clean up on anything? I know he's going to walk away saying, on that last question. Judge, anyone else? I'd be remiss. Anyone else have any? Tamika, thank you for, again, your great work on this.
If anyone needs Spanish, I can do a little bit in Spanish.
Let's have the mayor clean up in Spanish. And I'll defer to my chair, the big 13 mayors. Oh, you'll do it privately. Well, with that, again, look, I don't want to overpromise. I don't want to overpromote, but I'm not going to underpromise. We worked hard last couple of years to get to this point. A lot of thinking has gone into this, some of the best and brightest minds that we can source. We've done deep analysis of what's working, what's not working in our care system. We recognize the urgency in the crisis. We're putting $500 million up to deal with encampments in this state. There was not $1 2 years ago to help clean up encampments. But they're resolution grants to compassionately get people off the streets. 431 encampments have been cleaned up. We were down here in San Mateo just a week ago. I was personally cleaning up, as the mayor was the other day, in the outreach, cleaning up encampments. We need placements for those individuals. In each and every encampment we encounter, there's one or two people that clearly need this kind of support. And so it's that spirit that brings us here of accountability, resolving problems, but moving effectively and efficiently, and moving with a sense of urgency that the people of California demand, and understandably so, and deserve. So thank you all very, very much for being here.